Thank you for being here today. It's a pleasure to have you on a topic which I consider extremely important and interesting. My name is Dr. Olveen Carrasquillo, and I am the Associate Dean for Clinical and Translational Research at the University of Miami. And I'm also a Professor of Medicine and Public Health here at the University of Miami. I also serve as Director of our Cancer Center's Behavioral and Community-Based Research Core. And a big part of that is trying to find solutions to provide researchers with access to minority and underserved communities to make sure they're equitably represented in our cancer research. So the topic of cancer health disparities is near and dear to my heart. So it's a pleasure to talk to you about this today. So let me start by sharing my screen. And I'm hoping you can all see that correctly up in our screen. Move on to the next slide. Okay, talking a little bit about this series that we have with SEEK, this important partnership. Again, our goal is to end disparities in cancer care. And we want to provide, the series is aimed to provide resources to better help patients of color. So that's really important. And it's 6 workshops scheduled throughout the year. But today we're going to focus on a topic which I myself, historical trauma, have been very interested in. As I go along, it's not that old a concept. It's really been around for about 30 years. And importantly, I don't have all the answers. And because it is about historical trauma, it will be a bit political. And yes, some people may think that what I'm going to be talking about is, what some people are calling wokeness. So important to keep that in mind as you listen, because it may not be the most politically correct. But let me start. Usually when I talk about health disparities, I go through a lot of slides about cancer health disparities. Hopefully other sessions provided that. And then I start talking about what we call social determinants of health, which is the fundamental drivers of health disparities. And these are the complex relationships between health, biology, individual behavior, along with the other circumstances, access to healthcare, socioeconomic status, the physical environment, even things like discrimination, racism, literacy. All those are what we typically call our social determinants of health. And here's a list of them: access to care, social economic opportunities, quality of our schooling, our workplace, our food, our water, the air we breathe, and our social interactions. Those have traditionally been what we call the social determinants of health. What I'm going to postulate today is that there's this also additional thing we need to consider in delivering cancer services, which is historical trauma. And I'll start off with this slide here. Don't know how you guys can see it, but this is where the field of historical trauma was probably best. This is the field where the field of historical trauma was originally based. This is an American Indian boarding school. And this is, as I'll show you in a minute, a program of the federal government that really led to a lot of the writing about historical trauma that started the field going some time ago. So the federal Indian education system was a program started by our federal government and also missionaries. And it was a campaign to civilize American Indians and save them from the primitive way of life of Native Americans, This was carried out in the 19th and early 20th century, and there were about 350 of these Indian boarding schools in the United States. Thousands of children were forcibly separated from their native families. Children as young as 6 were taken from the reservations and placed in institutions far away from their families, stripped of their cultural identities. These schools were very harsh. They were really military schools. Kids had to cut their hair, wear uniforms, march in formations, very strict rules, very harsh discipline. Physical, mental, emotional abuse was persuasive. And in historical trauma, is that this trauma from these events were passed intergenerationally and continue to affect Native Americans communities and Alaskan Indian communities today as examples. So these are some of the propaganda that was used around it. And again, like many things at that time, people thought that they were doing something good, and they would say, hey, look, these were, Native Americans, they were savages, they're out there, and look, we turned them into these fine young men. But really, really was an extremely traumatic. These schools were horrible for kids. And they really, this was tremendous trauma, as I'll point in a second, passed down to the Native American communities. So historical trauma is really part of what we now know as transgenerational or intergenerational trauma. It's traumatic events that take place either to an individual or family or collective community and get passed down to subsequent generations. They're often perpetrated by outside forces. And, examples are witnessing war, genocide, or death, generations exposed to discrimination, oppression, violence, and several generations later, we have higher rates of disease in these populations. Some examples you may be familiar with are maternal abandonment of a child, and you see 3 generations of kids where this is passed down, or an abusive parent, and then that abuse is passed down across generations of child abuse as examples of transgenerational trauma. So historical trauma is one specific subtype of this. Historical trauma is one specific example of this that's linked to an actual historic event that was experienced by a group of people. So it's a collective group of people. And the impact is cumulative and multi-generational experience of this emotional, psychological injury, and then passed down to the descendants. So some people call it transgenerational PTSD because it really is a form of PTSD passed down, as I'll show in a second. And then we have the historical trauma response, which is the manifestation of these emotions and actions that stem from this historical trauma that communities experience. So for example, most of this are mental health outcomes where it's been best described. So suicidal thoughts and gestures, depression, anxiety, anger, violence, difficulty expressing emotions. These are all the consequences of historical trauma. And it's been used a lot to explain violence and substance abuse, higher rates of violence and substance abuse in certainly certain communities directly associated with the grief and, due to this historical trauma. So the theory is as follows. Mass trauma is deliberately systematically inflicted upon a target population by a dominant group. It's not limited to a single event, but it's continuous over an extended period of time. And these events reverberate throughout the whole population. It's a universal experience that can all cite, they can all reject to. And the trauma is so much that it derails, it stops the people from what they normally would have been, what their normal historical course would have been. And this is the legacy of the psychological, social, and economic disparities that we see in these groups. Okay. Now, talk a little bit, again, this is a relatively new concept. It's been around, again, first that started being described in the 1980s with the Native American, Alaskan Indian communities. So it's a relatively new concept. There's a lot of interdisciplinary research that supports this theory. But, the literature is largely theoretical and qualitative in nature. That said, it makes lots of intuitive sense, and it's gotten a lot of buy-in from many people, but the actual empirical evidence to support the theory is not as strong, and there's a lot of ongoing theory about, there's a lot of ongoing research in this area to try to generate that evidence. But it makes sense, and it's something that many people, now use to help and understand a lot of the problems. For example, this is one example from Native American and Alaskan natives. The life expectancy is about 5 years shorter than the general population, and they have much higher risk of many mental health issues: suicide, trauma, substance use, cancer, mortality, diabetes. These are examples where historical trauma has been used to try to help and understand this phenomenon. So for American Indians, we do know some of the health conditions. Alcohol, tuberculosis is another example. Diabetes, depression, and risk of suicide are some of the examples of historical trauma in these communities. Some examples of the historical trauma that causes some of these conditions. A more contemporary example, so everyone understands, is COVID. Take the example of New Mexico, where Native Americans is less than 10% of the population, but 60% of the deaths from COVID, highest risk of developing severe illness compared to any other group. And also, the explanations for this: limited access to healthcare, overcrowded multi-generational housing, high rates of poverty, chronic diseases that were risk factors for COVID, and limited access to care and other conditions. And also worse mental health outcomes. And so understanding how could COVID do this, we do have to go back and understand the historical trauma that these populations exhibited over several generations, which brings them to the conditions that made them ripe for conditions to an illness such as COVID to really differentially attack this community, as one example of historical trauma. Okay. So the best example, one of the best examples, is the Alaskan natives. But initially, it was the Russians that came to Alaska, again, to plunder the land. But of course, associated with that was a large amount of murder, drowning, diseases, starvation of the Alaskan native population. After that came the US missionaries to civilize the native population. And again, they had to turn their children over to these schools that were really harsh. Really downgraded their culture, told their spiritual world, spiritual practices were Satanist, and they were actually, their culture was, aligned with the devil. A lot of their traditional ceremonies in the interest of civilizing them were wiped out: their songs, their dances, their language. And these kids grew up without their culture, basically. They began to feel ashamed of their parents and of themselves. And no surprise, alcohol, substance abuse, and all these other conditions that we now see in Alaskan natives. And then we have the ongoing trauma. So the Valdez oil spill, I think now 20 years ago or something like that, again, reminds these populations of everything. Imagine you already have this history that you know about what they did, and then suddenly you see the large oil tanker and you see oil washing on your shores, you see your whales, you see all these examples. And this is how current events manifest themselves in historical trauma and lead to a lot of this unresolved grief. And for Native Americans, not just the boarding schools, they have lots of stories about the tremendous genocide inflicted upon them, infectious diseases that were brought, I'll show in a second, the blankets, but measles and mumps, the forced relocation marches, and again, the government-funded boarding schools. And these changes, basically, traditional way of life was upended: the traditional child-rearing, family structures, community cohesiveness, and of course, you have things like alcohol, suicide. One interesting thing I found was that, also as a result of this historical trauma, some communities have developed stronger spiritual and faith-based ties to cope with this, and that is certainly one of the strategies, as I'll get to at the end, to address historical trauma. So this is an example of the blanket, the well-known blankets that were brought to Native Americans, but really a biological warfare, as they had measles and mumps virus within the blankets, as one example. These are the forced marches. Again, many, many stories about this. Some are very popular. And again, if some of you will know, this is the kind of stuff that they're trying to take out of the textbooks now, because it causes some people to quote unquote feel ashamed of what happened to what their ancestors did to other groups. But this is very much Native Americans. They all know the story. You're not going to be able to wipe it from them. And it's important that everyone else recognize these events, because they really did happen and they were atrocious and terrible, these kind of forced marches. Another group, so going beyond the Native Americans, another group that has been well documented is the Jewish population and the Holocaust. They've done a lot of studies in this area. We know that descendants of Holocaust survivors have worse outcomes than those that didn't descend from this group. PTSD is one. Insecure and ambivalent attachment has been another study that has shown this. Second and third generation offspring have higher rates of PTSD, but also resilience that's passed down as well. But this doesn't only extend to Jewish. The Palestinians were displaced later in 1948. That's still a major historical trauma to the Palestinians. So they were kicked out a lot of their lands to make way for the other population. And they have much lower rate of self-health, poorer socioeconomic status, and higher stress as a result of this. And then this is pictures, right, of a Holocaust that we see. We're reminded when people see this 3 generations later, they realize that this were the great grandparents, for example. But then we still see this, as you saw last week up in Palestine, and you saw what happened in Gaza. Again, violence. We had, many of the main, roads were bulldozed over. You had a lot of the infrastructure, a lot of the electricity and water pipelines destroyed. And they saw this, and they remember when they were displaced. And this again reminds them of this historical trauma. And there's increasing, obviously, the population. African Americans have their own, tremendous sad legacy in this country that happened to them. Slavery, but then Jim Crow, segregation. And for African Americans, day to day, they see things that happen that reminds them of this historical trauma. If you saw George Floyd, for example, Breonna Taylor, they see this, and that again triggers the emotional and physiological responses because of this historical trauma, and they build on this cumulatively historical trauma. So every time they see something like this, it triggers back what happened several generations ago. So this is my visit to the South. This model's my wife. We visit these lovely plantations in the South. But then imagine African-American visiting, and these are the slave barracks there, and seeing this lovely, great plantation, but knowing that their ancestors were forced to live in incredibly terrible conditions, about 20 people in these tiny barracks, and how that awakens a lot of this historical trauma. And this is George Floyd. Imagine how they interpret this video in the context of the historical trauma that has been, and they interpret it very differently. For example, I was outraged. I was so mad and angry. We had a bunch of things we did at a university, but imagine adding to that the legacy of slavery and everything else. I do my own talk on Puerto Rico. I go through our own historical trauma in our country, starting when the US came to liberate us, even though we're already an autonomous country, immediately devalued our currency so that then they could buy up all of our, lands, all of our, sugarcane fields, our railroads, our seaport. So immediately they took everything the native Puerto Ricans controlled, gave us citizenship so we could serve in the military, and other things that are really horrible and atrocious. So every group has a lot of the historical trauma. Here I work a lot in Miami with the Cuban population, and how they were displaced by Castro when he took over and forced to start over again in the United States. And many of them still carry that legacy 3-4 generations later of historical trauma that was experienced by them. The New York Times just ran a great article last weekend in the magazine about people in Guam and other US Pacific Island territories. And again, terrible history and legacy of that as examples. So this is one conceptual model I want to talk about quickly before I get to what we do. But basically, it's how these narratives of historical trauma, then these public reminders and personal reminders of this historical trauma, and ultimately how that leads to health impacts. I mean, that's really what the theory is around. There are much more complex models. You guys can have access to these slides, but this is another much more well-developed model of how historical trauma carries on in population groups. And one of the things how is this passed down? I mean, you could think psychologically how it's passed down, but actually there's been some really interesting research on epigenetics and how these are actually modified and passed down from families to families. And so you do see these epigenetic changes in gene expression, which can be passed down, but also some of this is also the adaptive coping and survival mechanisms that can also be passed down. But there is some biological basis to this as well, which I found extremely interesting. All right, so I have about 5 minutes to talk about cancer. Now, the literature here is very limited on this, I will be the first to say, but basically we're talking about how depression, anxiety, low self-esteem, anger, violence affect cancer care. And again, there's lots been on mental health and cancer care, so this is just detailing on that. We know that cancer patients are at a higher risk for mental disease, psychological distress. That's been well established. And psychiatric morbidity is very common. And then the question is, does historical trauma make this worse? And the answer is absolutely. You already have the substrate that's even more for these adverse health outcomes. PTSD and cancer. We all know other ways that cancer can cause PTSD. Everything from getting the results, receiving, treatments, always afraid that it's going to come back, and really the loss of control that happens with PTSD, with cancer. And imagine now historical trauma on top of that being overlaid. And so, yeah, so the answer is yes. Does historical trauma make these things worse? And the answer is absolutely. Okay. And then even before the cancer diagnosis, you can use historical trauma to explain things like delays getting screened, delays seeking care, as examples, and more difficulties navigating the healthcare system as examples. So the treatment, you have to repair, their connection, their cultural values, individual counseling or therapy, spiritual help, renewal of the things. Some places for Native Americans have culture camps where they go to their traditional lands and they learn their traditional cultural practices. There's a family systems approach, which is also facilitating conversations with the older generations to tell their story, helps children begin to make sense of their origins, and parents also doing this. Culture-informed treatment approaches are also very important. It's a lot of what we do, and how these cultural values can facilitate discussions surrounding these events and also serve as a source not only of pain, but of pride, the resilience of the community. With Native Americans, all tribes are unique. Work with the tribes in this great, working with developing interventions, culturally appropriate interventions that emphasize traditional values and beliefs are very important. So what can you do? Know your community, know your history, know your data on them, and try to understand these social determinants of health and barriers to care in your community. Try to understand a little bit of the historical trauma and the legacy of historical trauma in the groups you're providing care to. And you need a multidisciplinary team to help you deliver care. People that know the community, also really important. Hire people who know and understand the community. We use community health workers. Some patients call them patient navigators, but we think that's a really important model that can help in this. And lastly, advocacy. We should also be advocacy, the proper response to this. Try not to remain mute, but try to be active in these things. And I'll end with a quote from a famous Native American physician. He talked about Native Americans. It's time to consider a Marshall Plan for Native people throughout North America. We must assist and empower tribes and Native communities in developing policies for governance, education, access to care. So that was a very brief overview of historical trauma and contextualizing it within cancer care. Again, if you have questions, please put them in the chat box. I'll be glad to answer them. And again, thank you for being with us and this quick overview of historical trauma and how it may impact cancer care. Thank you.